Alright you guys, welcome back to another video lesson from ICU Advantage. In today's lesson, we're going to be talking again on the topic of COVID-19, and specifically in this lesson today, I'm going to be talking to you guys about one of the major complications that we're seeing in these patients with COVID-19, something that we refer to as cytokine storm. Essentially, all around the world, we're seeing what appear to be these mild cases of COVID-19 really deteriorating rapidly into these more severe cases. There are some thoughts and even some evidence showing that this may be the result of a cytokine storm happening in these patients. It's certainly not happening to all the patients with COVID-19, but we are seeing a lot of findings in these severely ill COVID infections that appear to have the clinical and laboratory findings of cytokine storm. So we're going to talk a little bit more about what that is and kind of give you guys a better understanding of what's happening in the body, as well as some of the things that we can use to try to detect that our patients are in a cytokine storm, and some possible treatment modalities, either that we have available now or that are being looked into in the future. So stick with me, I've got a lot of really great information to cover with you guys here. But before I begin though, if this is your first time to this channel here and you'd be interested in more of these critical care, in-depth educational videos such as this one here, then I really invite you to subscribe to the channel below. When you do, make sure and select all notifications, that way you'll be notified as soon as I release a new lesson and you'll never miss out on one. As always, I really appreciate the support of you guys out there. It's been a very busy past couple months. I appreciate your understanding and some of the time away that I've had. And I hope you do enjoy this video and the series of videos that I have planned coming up here in the future. And so with that said, my name is Eddie Watson, and this is ICU Advantage. So let's go ahead and get into talking about the cytokine storm here. This is something that is often also referred to as cytokine release syndrome, and is also very similar to another disorder called macrophage activating syndrome. So this isn't something that's new specifically to COVID-19. We've seen this type of presentation for quite some time with a lot of other disorders out there, but with each of those disorders, they're all different from one another, much in the same way that what's kind of happening with COVID-19 in its own ways is different from a lot of those other disorders. And so I'm going to go through and talk about what's happening here specifically with COVID-19, but really to understand this stuff, we have to kind of start off with some basics and really talk about what are cytokines. So essentially at their core, cytokines are going to be small soluble molecules that really serve as messengers for the immune system. And we can think of these as hormone-like in the sense that they're signaling molecules, and they consist of various proteins and glycoproteins. Now, they're produced by a wide variety of immune cell types, and here think about your neutrophils, basophils, eosinophils, your mast cells, dendritic cells, monocytes, macrophages, B cells, and T cells, all the different leukocytes, lymphocytes of the immune system. And so now these cytokines and molecules serve as the intercellular mediators by binding to specific receptors called our cytokine receptors on the surface of cells. And what they do is they're going to change the activity of a cell by altering functions of proteins inside the cell or by changing the expression of certain genes. And they can have differing effects. Some are going to increase while others actually decrease activity. And ultimately, these cytokines are going to have an impact on the growth, development, maturation, activation, and lifespan of immune cells. Now, while we're here, I do also want to differentiate between cytokines and something that we also call chemokines. And so chemokines are a separate set of molecules that really help to direct the movement of white blood cells in the body. And these messengers are going to help to bring neutrophils, monocytes, macrophages, and other lymphocytes to the site of infection. Chemokines are also pro-inflammatory, and this is going to be important later when we are talking about some of the responses we see in cytokine storm. And so to give you just a quick overview of how this works, let me go ahead and draw an example of two cells here. And so we're going to have some sort of activating stimulus, which is going to cause a release of cytokines. They're going to bind those cytokine receptors, and this is going to cause some biological effect. Now, the cytokines normally have a short half-life and mostly act over short distances. So here we can think our autocrine and our paracrine. But we can also see these cytokines enter the bloodstream and see a systemic effect. So here, think our endocrine system. And speaking of, this is a really quick overview of some of the processes that are happening here. I'm going to link up above to a series of lessons that I did on the endocrine system that does go a little bit more in depth into some of this stuff and more specifically covering the endocrine system, obviously. Now, one of the nice things about these cytokines, though, is they have a very high affinity for the cytokine receptors, making them effective at low concentrations. So now let's actually talk about the different kind of cytokines that we have, and to do that, we're going to talk about the structural groups of cytokines. Now, as we talk about the structural groups and the cytokines in these groups, this is going to be a very high-level overview, but I do want to cover the 4 main groups that we see, and they are our interleukins, our tumor necrosis factor, our interferons, and our colony-stimulating factors. So first, let's start with the interleukins. The name comes from 2 different Latin words, inter meaning between, and leukos meaning white. So basically, these are the cytokines that communicate between white blood cells. And there's 35 known interleukins named IL-1 through IL-35. These cytokines are produced by leukocytes to act on other leukocytes, although other cells may also use interleukins. And these really play a key role in our immune response. And these cytokines can either be pro-inflammatory or anti-inflammatory. So just some examples of our pro-inflammatory cytokines would be our interleukin-1 alpha, interleukin-1 beta, interleukin-6, and interleukin-8. And interleukin-6 is actually one of our key mediators of cytokine storm here. Now, examples of our anti-inflammatory ones are going to be interleukin-4, interleukin-10, and interleukin-13. And another important one here is going to be our interleukin-10, and we see the production following cytokine storm resulting in a decrease in neutrophil and monocyte function within our systemic circulation. This is something that's sometimes coined immunoparalysis. So those are our interleukins. So now let's talk about our tumor necrosis factor. Now this one's also a pretty large group of 19 different forms of this, and this is produced by mast cells, macrophages, and T cells. And these can play a major role in immune cell activation, differentiation, growth, and death. One important one to know here is our tumor necrosis factor alpha, as this one is a major pro-inflammatory cytokine. This can be involved in potent activation of our cytotoxic T cells during infection and inflammation. It plays a central role in viral disease and a prominent role in the cytokine storm. And in fact, the blockage of the tumor necrosis factor alpha is a major therapeutic treatment for autoimmune diseases and inflammatory disorders. So now let's talk about the interferons. These are interesting because they're actually named for their ability to interfere with viral replication. And there's 20 different interferons that have been identified in humans. There's 3 different types of interferons. The third one's really kind of new, and I'm not going to talk about it here, but the main ones are type 1 and type 2. And our type 1s are going to be our interferon alpha and interferon beta. And these interferons are actually produced by many cells, not just the immune cells, in response to infection. Now, there's only one type of type 2 interferon. It's one that we call interferon gamma. Now, this one plays a role in many immune responses, and it also increases the phagocytosis of our macrophages. Now, as I alluded to with what their name suggests, they actually have an antiviral role. And essentially what happens is when we have an infected cell, it's going to release these interferons. And so if we have a neighboring cell that is not infected, when these interferons bind with that cell, it's going to produce these antiviral proteins inside that cell that degrade viral RNA and really inhibit protein synthesis. Now, interesting to know that our type 1 interferons are actually used in the treatment of viral infections. An example would be like hepatitis C. All right, and so last I'm going to talk real quickly about our colony-stimulating factors, or our CSFs. And these essentially act on stem cells in the bone marrow to stimulate growth and differentiation into specific cells. There are a few different types of our colony-stimulating factors. We have our monocyte colony-stimulating factor, or our MCSF, our granulocyte macrophage colony-stimulating factors, or our GM-CSF, our granulocyte colony-stimulating factor, or GCSF, and we have our erythropoietin. Now, I'm not going to talk about erythropoietin here, but our MCSF impacts the growth of monocytes. The GM-CSF helps with the growth and differentiation of dendritic cells, and our G-CSF helps with the differentiation and development of neutrophils. All right, so now that we got that real quick overview of Immunology 101, let's actually get in and talk about what is cytokine storm. All right, so here really the term is not well defined. We see similar types of presentations with other diseases, both pathogen stimulated and autoimmune. But here what we're really talking about is using this in the context of an immune response that is more than it should be. And so in any infection, including our viral infections like SARS-CoV-2, an immune response is necessary to combat the pathogen. But what we're seeing in a subset of COVID-19 patients is this immune response really becoming dysregulated. And so in normal cases, we'd expect to see a rise in our immune response, which is then lowered over time and eventually resolved. But instead, what we're seeing in these patients is a few weeks after their initial infection, we see the immune system ramp up more than it should. And so this can lead to a deadly, uncontrolled, both local and systemic inflammatory response. And this is going to be the result of a release of a large amount of these pro-inflammatory cytokines, as well as many different types of white blood cells. And this is really associated with the morbidity and mortality that we see in these patients. The important thing to know here, though, is we're not really sure of the cause of this hyperinflammatory response. And so that leads a lot of questions in what's happening, how we can treat this, and really ways that we can try to prevent our patients from having this complication. All right, and so next I actually want to talk about the progression that we see in these patients with cytokine storm. All right, so really everything starts out with our virus that we have here, and most often appears to be that this is starting out within the alveoli. And down in the alveoli, we actually have these type 2 pneumocytes, which are the ones that are actually responsible for producing the surfactant. And when the virus gets down in here, it actually will infect these cells via the ACE2 receptors. Inside of one of these cells, viral replication is taking place and the virus is making many copies of itself. And then eventually they will burst out of the host cell. Now we already know that due to the damage of this cell, that we are going to be giving off the cytokines and inflammatory markers. In addition to that, the antigen here is going to come in contact with our antigen-presenting cells. Think of our dendritic cells here. And this is really an essential part of the body's antiviral immunity. Now here, a couple things are going to happen. We're going to produce IgM and IgG antibodies. We're going to stimulate the humoral and the cellular immunity. And this is going to be mediated by our virus-specific B cell and T cells. And then these cells are going to produce these inflammatory cytokines. Now, again, this can be a normal process for some people, but again, in the subset of people, that this is actually going to lead to that deadly, uncontrolled, systemic, and local inflammatory response. And so the cytokine storm leads to a powerful attack by the immune system on the body. This typically is going to begin in the lungs and then spread to the rest of the body. Now, in the lungs, what we see is the overproduction of these pro-inflammatory immune cells and cytokines cause inflammation and edema, which can cause respiratory distress, acute respiratory distress syndrome or ARDS, and can also lead to secondary bacterial infections. Now, our T cells and natural killer cells are potent contributors of cytokines to this inflammatory response. And these are going to contribute to the vasodilation and edema, which is ultimately going to increase our extravascular pressure, decrease tissue perfusion, lead to endothelial dysfunction, and compromise the integrity of the endothelial cell junctions. All of this is going to complicate what we have going on here. And then in addition to that, we're going to have plasma proteins and cellular debris that's also going to accumulate. Now, of these cytokines that we have here, our tumor necrosis factor alpha and our interleukin 6 are going to be our primary contributors to this cytokine storm. And some of these severely ill patients that we see have this increased level of these pro-inflammatory cytokines, these interleukin 6s and tumor necrosis factor alpha, but we also do see some elevation of other cytokines like interferon alpha interleukin 1 beta, as well as some chemokines. So there's a lot of stuff that's kind of happening here that we're just starting to kind of wrap our heads around and start to understand in hopes of being able to treat this. Now, like I talked about here, the cytokine storm in the alveoli can lead to this acute lung injury, which then can progress into ARDS. And it's this severe inflammation that damages the local tissue structures. And ultimately, healing can occur with fibrosis, though, leading to sort of persistent dysfunction. So certainly some long-term effects of what these patients are going through, even if they do survive. Now, like I talked about over here, all of this stuff, all of this cytokine storm can happen systemically and have an effect on other organ systems in the body, leading to systemic clinical presentations, aka multi-organ failure. And here we can see an impact on the renal system, our hepatic system, our GI, cardiovascular, and even our CNS. Now, that was a quick rundown on sort of the overview of the progress of what we see in the cytokine storm. I want to jump real quickly into talking about, ways in which we would diagnose this. Unfortunately, though, there really is no true objective test to diagnose cytokine storm. There are, though, a few tests that we can use that give us an indication that this cytokine storm is about to happen or is currently happening in our patients. Now, the first one is going to be to check our patients' ferritin levels. And our normal levels here are going to be 12 to 30 in males and 10 to 150 in females. And what we're finding in COVID-19 is actually levels elevated in the thousands. Now, typically ferritin's known for its role in our iron storage regulation, but we also find an elevation in our ferritin in many inflammatory states. Now, in other types of cytokine storms, we'll actually see a much higher ferritin level than we'll see in COVID-19. Examples of this are like HLH and CAR T-cell therapy. But essentially, the ferritin levels are increasing due to pro-inflammatory cytokine signaling. And the takeaway here is that tracking the serum ferritin levels may be a useful early marker for cytokine storm in these COVID patients. Now, next we can also look at our cytokine biomarkers. And so first one I'm going to talk about here is actually going to be our specific biomarker assays. Now, these are really great because it can give you an indication of each specific type of cytokine and what your levels are. Unfortunately, these aren't readily available in most hospitals, so the real importance of these here is going to be helping to guide our research into potential medications to treat this cytokine storm. So the next biomarker I want to talk about is our C-reactive protein, or CRP. Now, the nice thing with CRP is this is actually produced by the liver in response to our interleukin 6. And so this actually allows it to serve as a reliable surrogate for IL-6 activity. It is an acute phase reactant, which makes it a marker of inflammation. And so if we see a rapid rise in CRP, this can help to identify patients who are at risk for cytokine storm. As well as the CRP levels begin to fall, they may also indicate the peak of the response has passed. And the really nice thing here is that this is cheap and readily available for testing in hospitals. And the last test that I want to talk about here is going to be our D-dimer. And one thing that we know is our coagulation system is active in critical illness. And we find that the D-dimer levels do correlate with the activation of pro-inflammatory cytokine cascade. Now, our normal for our D-dimer is going to be less than 500. And there may be other processes that are involved with our D-dimer elevation in these COVID patients, but it can be used as another indicator of cytokine storm. If we see an elevated D-dimer in this patients, this is associated with increased risk for multi-organ failure and death. And so what we want to watch for is this initial elevation of the D-dimer, and then a marked increase, sometimes 3 or 4-fold, is really associated with this increased mortality. So again, some really good tests to help to bring our attention to this and possibly catch the cytokine storm early on or before it really ramps up. But again, we don't have that true objective test to diagnose this. All right, and so finally, I just want to move on and talk about the treatment options that we have for cytokine storm. Now, when we talk about treating cytokine storm, much of our treatment is going to be our supportive treatment for what's going on with them. But the sooner that we can spot this and treat the condition, the better the outcomes are in our patients. Now, fortunately, we do have a history with treating these other cytokine storms with some of these other disorders, these autoimmune disorders, as well as some responses to treatments that we do for cancer patients. But again, COVID-19 right now is just so novel that we're trying to figure out what the possible treatments are and really what might be effective for these patients. Some of the concerns that we also have too is in using some of these immunosuppressive therapies that I'm going to talk about, not in the environment of a pathogen-free response. So think of these autoimmune disorders where if we give these immunosuppressive drugs, we don't also have this pathogen-mediated response going on in the body at that same time. And so really we're kind of faced with a situation where we're balancing having less effective reduction of viral load against having this immune response, which can lead to mortality in our patients. And so we can really kind of think of these anti-inflammatory and immunosuppressive drugs as really either being helpful or harmful, really kind of depending on when we give them to our patient. And some of the questions that are coming up are, giving early broad spectrum anti-inflammatories, well, that might not be effective as they could suppress our patient's immune response. And so as we know, our immune response is really important in the suppression of viral infections, and we really might not want to inhibit that. Interestingly, with SARS and MERS, so past coronavirus infections, they did studies with methylprednisolone, and they didn't see any benefit, and perhaps there might have been some detrimental effects from their use. Now, that being said, many places are using this as a treatment option, especially in cases of severe illness and cytokine storm, and it appears that this may be an effective treatment option. Now, we also have all sorts of studies that are underway and looking at which inflammatory mediators are at work here with COVID-19. And so by studying the body's immune response and which of these cytokines are being active in this cytokine storm, we can try and narrow down drugs that might specifically impact the effect of these specific cytokines. So we have many drugs and treatments that are being investigated right now, and it really would be impossible for me to list them all out. As I said, there's a lot of these different drugs that are being used for autoimmune disorders, rheumatoid arthritis, treatments for cancer, and other types of disorders that we've already dealt with in the past. So we're trying out a lot of different things and a lot of different theories based on some of these specific biomarker assays that are being done. But some of the things that we're looking at are like our interleukin-1 and ways to possibly block or inhibit that. Our interleukin-6. This one I talked about earlier is found to be elevated in the patients with COVID-19. And if we see this early elevation in patients, that typically means we're going to see poor outcomes. And we have drugs out there that are currently being trialed, things like IL-6 inhibitors, IL-6 receptor blockers, which really is an antibody that kind of blocks IL-6 from the receptors in which it acts. We're also looking at IL-10. And if you remember that immunoparalysis and this correlation between our IL-10 levels and our viral loads, we're looking at options for if blocking the effects of that would be effective. Like I talked about earlier, our type 1 interferons, we know are being effectively used to treat viral infections like hepatitis C, as well as the drug maker GlaxoSmithKline is investigating an arthritis antibody, one that's an anti-GM-CSF. Again, there's all sorts of drugs that are currently on the market to attack or inhibit these specific cytokines, and there's even much more that's being looked into and researched beyond what I just talked about here. Ideally, though, we want to look for ways to prevent the cytokine storm. If we can catch these conditions early and prevent them, instead of fighting against them once they're in full effect. All right, and so with that said, that's going to conclude this lesson. Hopefully this was a good overview, gave you guys some good understanding of what actually is happening with cytokine storm in these patients with COVID-19. Again, this new virus, there's so much going on and so much research that's being done and trying to find ways to effectively combat what ultimately in some of these patients is an attack of their immune system on their body, unfortunately having pretty dire consequences for these patients when they get it. So in the comments below, I'd love to hear what you guys have seen, what your experiences have been with the cytokine storm, what kind of things are your doctors doing and trying. I really just would like to hear about it because there's so many different things going on and everything. A lot of this is so anecdotal and what's effective. And sometimes it's nice to just hear that information from different sources and different places around the country. As well as if you like this video, please go down below, hit that like button. It really goes a long way to help support this channel in the YouTube algorithm. That said, keep an eye out for future videos. My available time is starting to free up a little bit more than it was. And so hopefully I will be able to continue making these videos. I'd like to get back into the regular sequence that I was doing, at least one video a week before all this happened. I do have some additional videos specifically related to COVID-19 that are in the pipeline and that I'm currently working on now. So again, if you haven't subscribed, subscribe to the channel so you won't miss out when those videos become released. And with that said, you guys have a great day and we'll see you next time.